Now, assuming this gets cleared in the House, and by the way, that could be a leap of faith here. You could always be surprised. There's not a lot of wiggle room with this, to what Jerry and Adam were pointing out. But then what would happen in the Senate, where there are very different views on this, and the wiggle room is far less, 2 votes, really. So what happens there? Republican Senator John Hoeven of North Dakota, Senator. Obviously, there are differences in the way the Senate tackles stuff like this versus the House, but there's less wiggle room, too, in the Senate, isn't there?
Right, there is. And so that's going to be the challenge, is how do we take whatever the House passes, which I think is a work in progress, and to make improvements that can get it through the Senate. And that's going to be a challenge, but that's something we're already working on.
You know, I don't know what the total dollar cost is yet on this measure versus the one that is existing right now, or whatever you and the Senate might come up with. But I am concerned as to, in order to win over votes, they're throwing a lot of money at this, and $8 billion more on top of the $130 billion to deal with pre-existing conditions and the higher premiums and risk pools, whatever you want to call it, that come with that. Is this, to your knowledge, Senator, significantly less than the dollars being doled out for the Affordable Care Act now?
Well, it is less, but remember, the objective is to make sure that people have access to health care insurance and health care, and then create incentives to do it more cost effectively. So it is less, and we do look at the scoring, but in the end, we want a product that accomplishes just what I said.
Obviously, the process is, assuming this passes in the House, goes to the Senate, you guys work on it. Assuming you pass something, flip back to the House to settle whatever differences or disparities there are. What's your best case scenario, Senator, when this gets done, approved, signed by the President?
It's going to take some time to move it through the Senate to make some of the changes that we think need to be made, strengthening the refundable tax credit, making sure we address the Medicaid in a way that works, ensuring that people with chronic illness and are covered, and that people with pre-existing conditions are covered. That's going to take some effort, but we already have amendments that we're working on that we are going to offer to try to do that. The key here, Neil, is that it gets done right rather than done quick.
Then, if you don't mind my pushing these dates, is it fair to say you can't really begin in earnest on the tax cut proposal from the White House and the one that you guys have crafted, the one that the House has crafted, until all of this health care stuff is done?
I think we're already working on ideas for the health care.
No, I'm sorry, I wasn't clear. I understand that. But is it this health care thing has to be fully voted on before you can proceed to in earnest on the tax thing?
Right. To use budget reconciliation, that's correct. Remember, we're already working on the tax reform piece, and that this is just the first step on health care. You also have the regulatory piece, and then we hope to get the Democrats to engage with us at some point in a third step. But yes, this would have to go through budget reconciliation first before you could use budget reconciliation for tax reform.
All right. Senator, thank you very much.
You bet.
Senator Hoeven.